Hello, I'm doing my case portfolio assignment on a patient who's a 55-year-old male. Diagnosis is high blood pressure. Currently on a ACE inhibitor, 10 milligrams once daily, and states that he feels okay, denies any kind of problems like this, but his reading was 145/88. So as I was saying, it's a male patient, 55 years old, is being examined. The patient reported the reason for their visit was to have a follow-up appointment related to their high blood pressure. So they deny experiencing any negative effects and from the medication and is feeling generally well. Again, taking full lisinopril, which is a 10 milligram taken each day, and blood pressure is averaging a reading of 145/88. Once again, the diagnosis is hypertension. So what I'm using is a SOAP format to do an analysis and assessment of the patient and to guide my questions as I go through this assessment by not missing anything from head to toe and various characteristics of the pain. So the first part of the SOAP is the subjective data, and that is what the patient feels that they have. It's not empirical information. It's what they believe their situation is, how they feel, if they feel like they're improving, those kind of things. So we start out with the chest pain discomfort area. Have you had any pain or pressure in your chest, neck, jaw, or arm? When did it start? What were you doing when this happened? How long did this pain last? And the characteristics of the pain. Was it sharp, dull, crushing? Continuing the subjective assessment, are you having any palpitations or irregular heartbeat? Does your heart ever feel like it's racing, fluttering, skipping? Anything that doesn't feel normal to you, can you describe that? Edema, we want to know if there is a lack of circulation, blood return to the heart, which is usually gravity related. So you will usually see swelling in the legs, ankles, feet. The lower point of the body is the one that has to fight gravity the most, and that's where if there's not enough venous pressure, the blood cannot return to the heart properly. So has there been any weight gain? The thing that they would be looking for is asking them, do you have any weight gain? Do your shoes feel tighter than they used to? Do you notice any swelling? Continuing the subjective assessment, we're going to again describe the pain. Are you having dyspnea, or do you feel short of breath with activity when laying down? Do you wake up at night feeling short of breath? Are you having any dizziness, numbness, or tingling in your extremities? Any fatigue or weakness that you don't usually notice? Risk factors. Do you smoke or vape? How much, how long? What is your diet like? How much salt, alcohol, caffeine are you consuming per day? Do you have an exercise regimen that you use? Do you have a history in your family of hypertension, cholesterol, diabetes, anything like that? What medications are you currently taking? And these include either over-the-counter type medications or even herbal supplements can also be of concern at this point. Now we're moving on to the objective data. This is where as clinicians, as practitioners, that we will look at what our findings are. They won't be based on an opinion. They will be based on empirical hard information by using diagnostic tools that will measure things so that it is actually a hard form of a response. It can be documented as a number or some kind of a condition. So I would be looking at the face. Do they have cyanosis? Are they showing a lack of circulation going to their face that usually is indicated by a kind of a bluer tint to the do they have any deformities when they're in their chest that could possibly be causing pressure against their pulmonary system? Extremities, again, we're going to physically look at them, not just what they said. We're going to physically look at their feet to see if there's any kind of swelling, edema. Skin color, again, temperature. We want to do the capillary refill to see if there's a good blood return to fingernail area. Palpitations, we do an auscultation so that we can listen for any rhythms, murmurs, lung sounds. We're listening for fluid because typically when someone has hypertension, that affects the pulmonary system, and they will tend to collect fluid because they're not efficiently removing the blood flow throughout the cycle of the circulatory system. So continuing with the SOAP objective part of the assessment, blood pressure. It's very important that the correct cuff size be used because depending on the anatomy of that person, if they have a smaller arm or larger arm, the tightness of the blood cuff will indicate either a higher blood pressure than normal or a lower blood pressure. So it needs to be proportional to the anatomy of the arm. If someone has a large arm, they need to use a large cuff. If they were to use a small cuff on a large arm, the pressure that would be developed in the cuff would be artificially higher than it should be, because it's tightening up that shorter length much faster than it would have normally if it was a longer length. And that translates to more mercury pressure, basically, in the system, or pneumatic pressure, I should say. You also want to follow the standards the American Heart Association and the Cardiology Association have created, which is to have the patient to wait 5 minutes before you take their blood pressure, and then take their blood pressure, wait another 5 minutes, and take their blood pressure, and then you are to add the two together and divide by 2. So let's say, for instance, you also want to do the physical examination, auscultate for bruits on the carotid, abdominal, femoral. Want to look for DVTs, deep vein thrombosis, or JVT, jugular vein distension. And again, you're listening for edema or murmurs in the heart as you auscultate. These are all indications of abnormalities that need to be addressed further to find out how far they are serious to the health condition of the patient. Two other areas that you want to look at: the vascular and fundi or fundus of the eye. The neurological assessments for signs of a stroke or dysfunction, because sometimes patients can have a stroke, not be aware of it, have a TIA, where it doesn't do any permanent damage, but it may still at the same time affect the way that their facial muscles respond. And so you're looking for those kind of classics. And then also the optic of the fundi. You want to look at the optic disc and the arteries that come from there. The reason this is so important, because these are capillary size blood vessels, and they're very susceptible to rupturing if there's too much pressure coming from the circulatory system to the optic system. So it's very common if someone has high blood pressure that one of the things that can happen is it will show some kind of abnormality of the fundi, the optic system itself. And then, of course, body mass index and waist circumference. There is a formula that indicates that the larger your waist is in proportion to the rest of your body, that you have a higher risk for cardiovascular and cardiac type of concern. Then we move on further in the objective, looking at lab diagnostics. This would be the tent pole, basically, of our assessment. This is where empirical data is really being looked at a molecular level and a systematic level. So we're going to be looking at renal function, looking at how the kidneys are responding to serum creatinine, blood urea, and nitrogen. We're looking at the glomerular filtration rate, so we can verify that it is filtering like it should at the rate that it should be filtered. And urinalysis, we want to see that the kidneys are not passing through things that they shouldn't be passing through, such as protein or metabolic panel. We're looking at cholesterol, high-density lipids, low-density lipids, triglycerides, and we definitely want to see if the sodium-potassium pump is working properly in the heart. So we don't want to have too much potassium or too little potassium. Then we're going to be using a ECG or EKG, however it's normally called an electrocardiogram, and we want to be looking at the left ventricular hypertrophy, finally, white coat, hypertension, where someone just feels a natural intimidation by being in a clinical setting, hospital, around healthcare professionals. What happens is anxiety is caused by that environment, and that basically causes the autonomic nervous system to kick in, and then you have the sympathetic nervous system that is the fight or flight type side response to the nervous system, and that results in higher heart rate, higher blood pressure, which means that their homeostasis is not really having a problem with the blood pressure, but it's being provoked by the environment and the anxiety it's caused. Okay, so now we're still in the objective portion of this, but we're looking at the pathology. We're looking at the certain areas of the body that could have target organ damage. So again, we're looking at the heart, left ventricular hypertrophy, using a ECG, which basically is a diagnostic test that uses electrical electrodes that are attached to various parts of the body so that it can have a various view of different angles and sides and lengths of the heart. This basically results in electrical connectivity going to a system, to a machine that is connected to these electrodes, and it shows a view, picture graph basically, of how the heart is operating. If all the chambers are functioning properly, if the blood flow is following the proper, and this is basically looking at frequency and amplitude of these various characteristics, which are the result of what we see when we look at a cardiac strip, showing the PQRST section of that graph, where the P is the right atrium, and so on. They were also looking at the eyes because, once again, additional pressure caused by high hypertension, because the eyes have microvilli basically for their arteries, very small, and they are subjected to any additional pressure. They are prone to rupturing, and that causes hemorrhaging over the eye. And by doing this fundoscopic exam, we're able to look at the condition of the optic disc and also the arteries that are radiating from the optic disc to see if there's been any, which is also known as. Also, we want to look at, because we have compromised blood flow, meaning that the heart works harder, causing a higher blood pressure. This can also put additional stress on the vascularity of the brain and can result in a stroke or a TIA, where we're looking at that. The next thing is the secondary hypertension screening. This is where there is a secondary reason for hypertension, such as a comorbidity, such as a aldosteronism, thyroid dysfunction, or renal artery stenosis, where there's a blockage to the kidneys, and that's causing additional back. So as we move forward, we leave the assessment section and we move into the plan phase section. And this is looking at a plan using non-pharmacologic interventions. So we want to look at our eating habits. There's pictures here that you can see. The top one on there is an example of junk food, things that we like to eat but aren't necessarily nutritious or healthy to our bodies, and can also cause performance compromising situations. So we tend to like sweets, fried foods. That's because our taste buds are sensitive to these, but we weren't meant to eat them in excess, and that's why we have problems with our health. It is proven, in fact, that many hypertensive patients have a history of poor. So if you eat junk food, you are increasing your risk for any kind of. And then activity. Our bodies like activity. They do not like to be still. Our bodies are designed to be active and to have a lot of exercise. So we want to find out if what the lifestyle is. Do you have a job where you're sitting at a desk all day, and then do you go home and maybe get some exercise, physical exercise, or do you continue to just either sit and eat your dinner and then go to bed? These are things that causes your heart to get weaker because it's not getting enough. So this leads to obesity and higher hyper. Do you drink a lot of alcohol? This can also increase coffee. Anything with caffeine can lead to. What is your sleeping habits? Sleep regularly for a certain every day of the week, or do you have a sporadic sleeping? Do you find being very tired in the middle of the day because you didn't get enough sleep for the night before? That's also hyper. So one of the easiest things that we can implement in the plan for a patient is to take their blood pressure. This can be done at home with various devices. You could use the traditional pneumatic blood pressure cuff, Engage, or you can find digital versions of this type of a cuff. You can even find a wrist cuff that is digital, and it really takes very little skill to take your blood pressure. Sometimes they're considered not to be as accurate, but if you have taken a pneumatic blood pressure cuff, the traditional type of reading, and then you were to take it with the digital version of these, if you find out that they're very close to each other, you can be comfortable that it's probably going to be accurate enough to document your results and feel comfortable that they are correct and can be. The things we're going to ask is, what is my blood pressure today? Okay, is this the same as other visits? What should my blood pressure goal be? How might other conditions affect this goal? Should I be checking my blood pressure at home? If so, how often? What monitor do you recommend? We talked about that. Are there other places I can check my blood pressure between visits if I don't have a blood pressure? That is a possibility. With various drugstores do have those kind of things, but I really believe that the cost of these home devices should be pretty much in everybody's ability to afford. You could buy them between $20 and $40. It just depends on what the type of deal. So I really don't see any reason why people wouldn't be able to do blood. When should I call my office about blood pressure reading? Doctor will make that recommendation. We know that you're hypertensive. If you get into the upper level hypertensive, where it's just like 170, 180, over 100, I believe it is, then it's concerning. And you probably need to go to the emergency room and be checked out at that point. I wouldn't even wait any longer by calling the doctor. What are the potential risks? My blood pressure remains high over time. Well, we already talked about that. It can cause target damage to various important organs in the body, such as the lungs, the kidneys, the eyes, brain. Very serious, needed systems can be affected. So we need to make lifestyle changes so that we. Okay, so we want to also look at patient education. What kind of lifestyle changes can I make? What lifestyle changes should I focus on first? That really depends on the person and their lifestyle, and what they have told you during the assessment interview. If they've told you that they don't exercise, well, there's something you would want to do. You want to implement a physical exercise program so we can start getting them healthier and getting their heart stronger. We also want to reduce the sodium they take, that they consume every day, such as 1,500 milligrams a day is the goal you want to look at. We want to look at foods that have a natural ability to lower, and also what is their weight? Is their BMI appropriate for? So we're going to work on them actually losing weight if they happen to be have an obesity level, or they happen to be way more than what. So what type of physical activity is best to lower my blood pressure? That's usually cardio, where your heart is working at a pre-prescribed level that is safe for your age and fitness level. You don't want to overtax your heart because that can cause major issues. And how does stress affect my blood pressure? We talked about that. That is the autonomic nervous system, and it is the sympathetic nervous system that kicks in with stress. It is the known as the fight-flight. Are there programs or medicines you can recommend to help me quit smoking and vaping? Yes. The American Lung Association typically provides free seminars on how to begin the process. There are various medications that can help you to quit smoking, but they need to be looked at carefully because sometimes they can also result in higher blood pressure, which is something. Continuing with patient education, we want to know, how do we decide if we need medicine in addition to lifestyle changes, and that will be basically a medical decision and also a patient decision on how well they think they can adhere to non-medical changes to initial startup point without medicine or very low doses is given to a patient to see if their lifestyle changes can effectively cause. So which medicines should I start on and why? Again, that depends on how faithful you are to doing non-pharmacological changes to your life before you can decide exactly what medicines you need. Will I need to take more than one? Then we have to look at the progress of the care plan and see if it's being effective. How long will I need to stay on this medicine? That's again a result of progress. What are the benefits and any drawbacks of taking it? Sometimes combination pills can actually be contraindicated either by reducing the effect of a pill or causing a synergistic effect where it actually multiplies the effect beyond what the two pills by. So what side effects should I expect? Well, there are various effects that will happen with any kind of medication. The typical ones are nausea, diarrhea, increased heart rate, sometimes rash. So we won't know until after the patient takes that medication. They have been taking linezolid, which is an ACE inhibitor, and they have claimed no problems with it. So the recommendation would be probably to continue on that medication and maybe increasing the dosage if the changes in non-pharmacological lifestyles take place. Then we would. Is renal denervation an option for me down the road? That will depend again on the results of Ongoing follow-up. How soon should I recheck my blood pressure after starting? I would say we do it daily, especially at a device that you can take at home and do this at home. So since when someone has a cardiac issue, hypertension, um, that is a very specific specialty, and also because the circulatory system basically goes throughout your body, it requires specialties for various parts of the organs in the system in the body. So endocrinologists, they are basically used to make sure there isn't some kind of chemical imbalances that's causing this, such as a blockade of the adrenal system. Registered dietitians, that's the way we would basically determine what would be the best diet for cardiac issues. Respiratory, if they're having a problem sleeping, sleep apnea, they're having hypertension because of sleep apnea, then they might want to have a CPAP or on to help them in their breathing process while they sleep. Snoring is one of the key things that tells us that maybe there is a problem with trying to get sufficient. And then again, a cardiologist, obviously, to go over the test results and to see if further tests. Nervous systems can also cause problems with the heart. They can cause problems with the kidneys not working properly. So that would be the referrals: endocrinologists, registered technicians, respiratory therapists, cardiologists, and nephrologists. Maybe even, depending on the results, you might add on. As with any profession, there are three things that we always have to consider. That is the ethical and legal and the cost of any procedures or any actions that we take for the health of the patient. So ethical considerations is to remember that the patient is the one who's actually in charge and makes decisions what we're going to do for them. They must always give their consent for anything that we do. They must also know that if they decide that they don't want to do the treatment, that is their right through the economy. The second ethical thing is that what we do will be based on an equitable basis, that it's justice and that it's fair and the proper thing that anybody should. The other thing is that obviously as healthcare providers, as health care professionals, we want to take care of the patient. We want to improve their condition. We want to keep them safe. We want them to live a very healthy and productive possible. And that means that non-malfeasance, to do no harm. Any procedures we do should never be with the intent that the other thing is that full disclosure should be always present at any kind of procedure or any kind of treatment, that the patient knows exactly what's happening and that they had consultation with the physician to the level that they desire, and that their family is aware of the decisions and they're making a joint decision on what's best. Legal considerations. We always will adhere to the laws set forth by the state and federal health departments, and that the expectations will always be met by the healthcare professionals from a legal standpoint. Once again, the legal right for informed consent and the privacy of HIPAA, that medical records will be protected from public view and protected from anyone who's not authorized to know that information. And that's in compliance with the state. And the last and very important point of the 3 points is cost. Cost consideration. One of the problems with the healthcare system right now is the exorbitant cost of getting treatment and also getting the approval of health insurance companies to approve treatment that maybe the patient wants and that the doctor has recommended, but because of cost restrictions in the healthcare insurance program, they're not able to receive them. So without comprehensive insurance, patients might face out-of-pocket costs and expensive heart condition treatments, which makes it very difficult for them to be treated. Patients might have to wait for treatment or consider alternative treatments that are not as optimal for their health, which I already said. They will look for things that the system is not going to provide assistance in paying for it. So it's a very, very important thing. And the ethical and legal costs are actually almost secondary to the cost considerations, because if you can't afford to have the procedure performed, then the ethical and legal things really are secondary to that. And so you have to be able to afford what you're doing before it even becomes an issue with either of the other. So in conclusion, This assessment has resulted in subjective information from the patient, which we can use to form a picture of their condition and what their concerns are. In addition to that, we will need to do an actual assessment, which is objective, and that will be looking at the various characteristics of the patient when they were being in the clinic for the assessment. So after that, we would go ahead and we would do what are empirical tests that actually show data and use diagnostic equipment for accuracy of their actual condition and be able to see how far the damage goes, where it is actually located, and what things can be done to correct that. So secondary hypertension target organ damage is suspected. That would require more specific tests, such as aldosterone, cortisol levels, or kidney ultrasounds may be needed. The patient will also require referrals to specialists such as cardiologists, nephrologists, endocrinologists, or vascular surgeons. And this is all to further examine the patient's condition and provide safety.